hear me okay? Awesome. So for today we're going to talk a little bit about ACO Health Solutions, which is a tool or a portal that we really love on behalf of some that we use as a way to give information out to our practices, and then it's a way for our practices to be able to track some reports, to be able to track their quality on their patients, and then when we get towards the end of the year, it's something that they're going to use for doing their quality audit as well. ACO Health Solutions is a group that started as a probably quality audit tool, quality audit company, and we've kind of taken them and worked with them over time to get some additional reports and get some additional information that we think has been really helpful for our practices to improve some of their ACO outcomes, get to know a few of their patients a little bit better, and use all of this data that CMS is trying to share with ACOs and put it in nuggets that is easy to process and make sense for practices. I know there are some other tools out there that we looked at, and I met with another director of a different ACO, a different company. We talked about her tool, and it was pretty snazzy, lots of bells and whistles. And I said, well, what do you guys do with it from a practice level? Well, what do you mean? Well, if you're not giving the right tool to the practice at the right time, they can't do as much with it, and how are you going to improve patient care? Because you need the tool that hopefully can be as close to the practice as possible to let them take advantage of the information that we have available to them. So today we're going to talk about the tool and some different ways in which I've seen practices use it to be successful. Now there's some things that we're going to talk about today that may not be a perfect fit for your practice. That's okay. Hopefully we're able to take the tool and have it best applied to your group and to your practice. The tool is probably a little bit more valuable for primary care providers than for some of the specialists. And the reason why it might mean a little bit more, or might be a little bit more valuable for some of the primary care providers, is within ACO Health Solutions, they attribute or assign a patient to only one provider. And with the ACO rules, a patient is more likely to be assigned or attributed to a family medicine, internal medicine, than they would be a interventional cardiologist or an interventional oncologist. So that's something that we're going to need to keep in mind as we're looking at the tool and figuring out how we're going to use it. It may not be perfect for every practice, but hopefully we're able to take the information and have it be as valuable as possible for you. So that being said, I talked a little bit about what ACO Health Solutions is just a second ago, and it's a practice-facing portal that has some reports. It's got some really neat quality information, and it has the ability to not only process the claims information that we get from CMS, but also enter absorb some information that will be able to come out of your medical records, your EMR, and then there's an opportunity to do some manual entry into the system as well. So this is going to be the tool that we're going to use January next year when we do our G-Pro quality audit. And this is going to be the tool that we use later this fall for our G-Pro mini audit. And that's an Imperium best practice to do kind of a mini audit about September, towards the end of September, start of October, as a way to get ready for the actual audit and just identify, are there any gaps in care, things that we should be checking for that we maybe haven't found yet. So I mentioned a second ago there are essentially three types of information that we might find within ACO Health Solutions. The most common and the one that is really kind of the most valuable for this tool is the claims information, or at least one of my favorite parts is the fact that we have all this claims data that we're able to process and absorb. Now ACOs receive monthly claims data from CMS usually about the middle to the end of the month, and it takes just a couple days for ACO Health Solutions to get it absorbed and available to you. And they also get these quarterly files that come out usually toward the end of April, start of May. We're going to get another one towards the end of August, and then around Thanksgiving time, and that's going to have attribution files in it, or patients that CMS is attributing to the ACO. And ACO Health Solutions takes that information and kind of says, all right, these are the patients that most likely you are treating, or most likely attributed to your group. So it makes it easier to take this these 9,000 patients attributed to UPQC and assigns them to the right practice. That claims information, that requires no effort at all by you in the practice. There's an opportunity to maybe pull some information out of your EMR, and we can do that by extracting what's called a continuity of care document, sometimes called a CCDA. And that's a process where you'll just kind of It's usually a report within your EMR or something that you can extract all of that information out, and if we do that, then that can be shared with ACO Health Solutions through a secure file transfer protocol. It's essentially like a HIPAA safe Dropbox almost, and then once we put it in there, then they're able to take that information, absorb it, and get it fed into the system. That's helpful for the quality audit. It can be helpful for the G-Pro. It's not required, but it's definitely encouraged if we're able to do it for your practice. We can also sometimes pull reports out, like maybe extract all of the medications that your patients are on, maybe extract the blood pressures, the BMIs for some of your patients, to help to provide additional insights into closing gaps in care. And then there's also some opportunities to maybe do manual entry. If we want to close gaps in care real time or document that we're making progress, we can go into the system and manually document some of the quality things that can be helpful for tracking those 15 quality measures and making sure that we're staying on top of them over the course of the year. Both the EMR and the manual entry, those are optional processes. Now we're going to work with you to, if it makes sense for your practice, to make it as easy and as effective as possible. But we will get to that point, and it may not be the first thing that we do for all of your practices. So kind of to start with, how do you get access to the system? So this is a pretty neat tool, and it's only as neat as the access that you have. So if you have any questions getting access, or any questions with your login information, or you maybe haven't been given a login yet, I know Lori and I are working to try and make sure that everybody gets access as soon as possible. But contact myself or contact Lori, and we will work with the system to make sure that we get you set up for your patients. Now, or for your, you have? Awesome. Thank you so much, Lori. So for those of you that Lori sent that notification out or worked to try and get you set up within the system, you probably received an email that came from support@acohealthsolutions.com. Now that's kind of a funky name to come in, because you're going to hear support and you may not have recognized it when it first came in. I would encourage all of you to go out, look at your email, and over the last couple days, I think Lori sent most of them out on Friday. So go in, try and see if you have any emails that came out on 3/26 from support@acohealthsolutions.com. And you're going to want to click that link, and it'll help you to set up your account and set up your profile. If you did not get the email, or you need us to resend it or reset it up for you, we can do that as well. It is an email that will time out, so the sooner you go in, the sooner you try and access it, the better. It's okay for us to reset it or to resend it out on your behalf, but if we've already sent it out once, if we're able to capture it right away, we always prefer to do that. So once you have your login and you go in the first time, you're going to go to a website that's pulse.acohealthsolutions.com. And I would say that's a site that you're probably going to want to add to your favorites, and you might be going to pretty regularly. As we set it up, and I think when Lori sent most of those initial requests out, she set most of your practices up, or most of you up, as administrators, meaning that the way you're set up, you likely have the ability to maybe add extra users within your practice, or to reset the password of those within your group. Sorry, was there a question from the group? Okay. So from my experience, I would say Google Chrome is my preferred web browser for using the tool. It's not necessary for you to use Google Chrome. You can be just as successful using Internet Explorer. Actually, when I made the demo last night, I used Internet Explorer, or made some changes to the demo. I used Internet Explorer for my account. I would just say, if you're using Internet Explorer, try and use the most recent version if you can. And if you're using Firefox or Mozilla, just try and use the most recent version of the web browser you can. Sometimes the functionality works a little bit better on a more recent or more current web browser. So once you're into the system and starting to navigate a little bit, you're going to notice that when you first log in, it might only say the word Imperium Health on the top, and there's going to be this little arrow next to it. ACO Health Solutions is set up to have kind of a drop-down or a waterfall type effect, where you're going to be able to see more information as you click into it or click a few specific spots. So whenever you see an arrow that's pointed to the side, if you click on that arrow, it'll oftentimes point to where it's maybe pointing diagonally down. And if you click on one of those arrows to the point where it's going to point diagonally down, you're going to have a little bit greater access, or you're going to see additional information. So for instance, if I click the Imperium Health, I would then see the name of one of your practices, and then I would see the year 2018, and then I would see the phrase Utah Physicians Quality Care, and then I would see quarter zero. Quarter zero just represents the initial attribution list, or that initial file that I said that CMS says these are your patients associated with your group, that would have came out at the very end of 2017. That's meant to reflect these are who we think are your patients. Now we're going to get different attribution lists over the course of the year, so when we get our next one, you'll see a Q1 tab that'll be in there, and when we get one that'll be towards the end of August, start of September, you'll see a Q2. And when we get one that's excuse me, around Thanksgiving time, you'll see a Q3. So I'd say just always try and make sure that you're going with the most recent quarter. And again, Q stands for quarter. So that would have been about the timing of when CMS published the information. So as you're clicking down through, you're going to see the different arrows. Sometimes you're going to want to click on the word in addition to clicking on the arrows, and that's another trick for being able to access a little bit more information. One of my tips for using the system for you guys is hover to discover. If you're hovering over something and if suddenly your cursor turns into a hand, or you have the ability to click into it, always do that. That's a way to see a little bit greater detail about our patients and about the information that's available to us. So one of the first things that I'd say you should go looking for, or what you should take advantage of when you see the portal or have access for the portal for yourself, is go out and find your Medicare Shared Savings ACO patients. So this is going to have the patients that Medicare says are attributed to our ACO or attributed to our practice. Now, this may not be every patient, every Medicare patient that you treat, but these are the Medicare patients that CMS is saying are associated with UPQC. So once you log into the system, oops, I just want to minimize a couple things for myself, make it easier for me to navigate. Click into the patients, and you'll see a full listing of all of the patients that CMS says are associated with your group. Now, if you want to take that list and export it into Excel to make it a little bit more usable for yourself, you're going to want to click this Export Link. So anytime you see this disk or a printer, those are going to be ways that you can pull information out and either have it printed or have it available to you on your computer. So the first thing I would say you typically want to do is you want to pull your list. You want to make sure that you know which patients we're talking about, which patients we're focused on. And that list is going to change quarter over quarter as CMS changes our attribution. The next thing that we're going to want to focus on is our quality, and I would say this is one of my favorite tools within the ACO Health Solutions portal, is the ability to look at our quality over the course of the year through the quality registry section. And it's almost like we're able to check our quality or even work our audit bit by bit over the course of the year. And the quality section and the quality registry is going to be populated by 3 sources of data, and I talked about this just as we first got started, but it's going to have claims data, like if you use a G0444 code to document a depression screening, or if you document for a fall screen, or if a patient maybe had a mammogram done, a patient had a flu shot that was given by someone else that billed for it to CMS. All of those bills are going to populate into to the ACO, and those will go to ACO Health Solutions. So anything that was billed for, including those procedural codes, those G codes, those HCPCS codes, those will show up within the system. Okay, so that's kind of one of the most common ways that we've seen information populated. One of the next ways that we've seen information populated is we can pull reports or pull that kind of CCDA file out of your EMR. Now it's something that sometimes the functionality of every EMR is a little bit different, and the way that every provider documents can be a little bit different. Some providers will clearly mark where a blood pressure is or enter it into a field that's a little bit more what I would call discrete, and some providers will document a fall screen or document a depression screen in the middle of an H&P note. And if it's in the middle of that note, it can be a little bit harder to extract that information to populate into the system. And then the third way in which I've seen information entered into the quality registry is a manual entry by the part of somebody in the practice. Usually it would be like an MA or a registration team member that when they have downtime here and there, if they ever do, they would go in and manually enter a few things into ACO Health Solutions to close or to track some of those quality gaps over the course of the year. So, and again, I mentioned different people might look at slightly different tools or slightly different functions within the system. The quality registry section is going to have different things for different people. If I'm an administrator of a practice, if I'm Lori coming from UPQC, one of the first things that I'm going to look at is how are we doing on the performance section? Are we kind of checking a lot of the boxes as a whole from the performance section? Now this is going to be a way to close or way to monitor our gaps in care, or those 15 ACO web interface and G-Pro measures over the course of the year. And by kind of tracking this information over the course of the year, it's going to set ourselves up to be a little bit more successful when it gets time to do the quality audit, because we know that we have all of the information captured. So we know not only that we're going to do well, but we know what we're going to be looking for. Now that kind of showing where are we at for every measure over the course of the year, that's interesting, and that's, I'd say, valuable, but it's not always necessarily actionable. So if we're looking to make improvements in each of those measures, sometimes we need to be intervening or working on that from a patient at a time perspective. Now if you click on the all measures or each of the individual measure sections, you will see a listing of patients that are eligible for the measure and whether or not we've entered data for those patients. So there's two different bits of information that we typically look at here when we're looking at the all measures or within a patient level of information. Now you can take this list, and for this practice they have 764 attributed patients. If they wanted to export that list of all of their patients, they would click this export function on the top, and that'll export all of the information for all their patients. But if you wanted to drill into one patient at a time, there's a couple ways in which we can do that. Probably the most common is we're going to take a look at the gaps report, which is going to be this blue link on the sign that says gaps. So once we click on that gaps report, we're going to get almost like a patient level snapshot or a patient level scorecard for which measures are they eligible for. So for this patient, we know that they need data or they need some sort of information to document that they have done a fall screening at some point this year. But we know that they're not necessarily needing data for diabetes measures, or maybe the hypertension measures, or maybe we don't need measures for the colorectal cancer screens because the patient is kind of aged out of that measure. But we do need documentation of a clinical depression screen. Now, I'm saying that we need documentation of it for this tool, for this bit of information. Entering information in here can help to track, to close those measures over the course of the year. I would say this is a best practice to do. Entering information in here is not the only way of performing well on your actual G-Pro quality audit, but I would say this is the best way to know that we're going to do well on the quality audit, or using this tool is one of the best ways to know that we're going to do well on the quality audit. For instance, if you're documenting, if you're tracking some of your information over the course of the year, when it gets time for the audit, it may take seconds to validate some of the information. If we're not validating, if we're not checking for some of the information, we may spend time looking for a tobacco screening. We may spend time looking for an influenza shot that we hadn't documented, and we may look through multiple charts to try and find it. Now, just because it says needs data in here, that doesn't necessarily mean that it wasn't done. It just means that it wasn't documented in a way that's easy to capture through this system. Capturing it through this system will make the quality audit easier. Now, if we ended the year and it still said needs data, what would end up happening is there'd be a little bit more rigorous process to try and look through each of the patient's charts or each of the patient's visits to identify, was there a fall screen done at some point during the year. Hopefully it was done as part of the annual wellness visit, and it was captured through that kind of workflow process with the well visit. Now, one of my practices that is probably done the best with some of their quality is they will take this and they will actually have an MA or a registration team member print this out for every patient coming in for a well visit. And that's their kind of visual cue that as they're going through the well visit, they need to make sure that they're documenting for this information, or at least validating that it's been done over the course of the year. Now, I said there was 2 links, and the first link was that gaps in care report, and that's that patient level scorecard. And the other link is we have an opportunity to drill in and see what claims data or what other information is available that can help us to close these measures over the course of the year. Now, this patient quality data is essentially going to be your claims data, your EMR data, and then any manual entry that someone might have done. And again, the claims data will populate automatically as long as anything that was billed for on behalf of any provider treating the patient. EMR data is something that we will go in and we will work with you to try and pull reports or extract information that can be pushed to ACO Health Solutions. And manual entry would be something that's done on behalf of the practice. Now, manual entry is not required. EMR data is strongly encouraged, but it's not 100% required. And claims data is encouraged to use some of those coding things, but it's not required. It's just these are extra tools, extra ways of absorbing the information. So we know for this patient they've met the measure for preventative 8 and preventative 10, so we can dig into then and see, okay, why did they meet the measure? What helped to satisfy it? So we likely have documentation of the procedure that caused it to help to satisfy the measure. So that's kind of patient quality, patient reporting in a nutshell. Now we're going to use this tool again late September, start of October to do that G-Pro mini audit. And that mini audit is going to build off of a lot of the information that's in here already, and we're going to look at just a small snapshot for each of your practices to retrain on the actual quality tool, and then just track our progress and see how did we do based on the information that we had entered up to that point. Now, the report section is probably the third or the next most common section in which you're going to use ACO Health Solutions. And the reports are populated just by claims data. So the pulling reports from your EMR is not necessary and is actually not included in the claims data or in the report section. This is going to be mostly driven by did you do a well visit? If you did a well visit, did you bill for it? Okay, as soon as that comes through, then it's going to show up here. And again, as a reminder that the claims data is usually about 30 to 60 days old. So we're going to get information once a month from CMS that's usually based on claims paid a couple weeks or about a month before that. So the information that's in here is a little bit dependent on those sending in the bill and the person paying the bill. Meaning that if you have a practice that is several months behind in your billing, your well visit counts might look lower than you believe they actually are. But it's because they're not being paid, not being captured, so they're going to appear to be a little bit less. If you have a home health agency that you work with or that some of your patients are being treated by that is slow about sending their bills into CMS and by getting paid, it may look like you have a patient that's not receiving home health services or that has not been discharged when they actually have. So the information in the report section is going to be very dependent on how good everyone else is at sending in their bills. I would say hospitals are typically the best at sending in their bills, and how quick CMS is about paying those bills. So the report that we're going to probably promote the most right from the start and is going to be used a little bit differently by different people is the annual wellness visit report. As similar to what I mentioned earlier, hovering over the printer or hovering over the disk is going to be the best way to, if I want to export this to Excel or if I want to print it to a file on my own. Now, within ACO Health Solutions, it's set up to have that little bit of a waterfall effect. So you're going to click on a provider level, and then you're going to click on a year, and then you're going to click on kind of the next step down, which will be maybe the different report section. So once you get into the reports, if I wanted to click on Tommy Lee and see which patients he was treating as part of the ACO that have had their well visit, or maybe the ones that are due for a well visit, if I clicked on his name, it would allow me to then see which is the list of patients that have had a well visit or maybe due for a well visit. And then performance here, as I'm looking at, or PY, that's meant to be the current calendar year, and that's going to be a year-to-date count. Because a well visit is a once every 366 days visit, it's going to show the information in here as a rolling 12 months. And then as I'm first starting to look at the data, I always try and make sure that I'm looking at my dates of service to ensure that I'm seeing the information that was what I expected it to be. Now there's always going to be about a week or I'd say 2 or 3 days when they're doing the data load where it might have the date that's a little bit more current than the actual information that's in here. If I'm a practice administrator, this is a report that I'm going to probably go to once a month. And I'm just going to probably try and track my progress over time using this report. If I'm a biller, I'm probably going to go in and track this to make sure that the visits that we thought were billing for annual wellness visits, they are getting paid and they are showing up. If I'm a scheduler or if I'm a registration team member, I might be using the patient level information, which we're going to get to next, to proactively schedule patients or to proactively get patients seen for an annual wellness visit. So if I'm using that patient level information, and again all I did was just clicked on Thomas Lee's name, was I can then see a list of patients that are attributed to Dr. Lee and have or have not had a well visit done in the last, or sorry, have or have not had a well visit done based on claims available. Now I would say as I'm looking at this, there's a couple things that really sticks out to me or that I really try and use. So there's going to be a list of patients that we know that have had a well visit done but are not due for the next one. Those are always going to show up on the top of your list. There's going to be a grouping of patients that have maybe had a wellness visit done in the past that either was done by you or maybe not done by you, that are they've had one done but they're due for the next one. And for instance, that would be Jeff Lynn on this list. And then there's going to be a listing of patients that have never had a wellness visit. So we can use this as an opportunity to start to proactively schedule those patients that have never had a well visit, or at least have never had one that was been done and paid for as a well visit. Now when I'm using this tool, one of the things I also like to look for is what was the most recent code billed for that wellness visit. So for instance, Jeff Lynn had a well visit done January 1st of 2016, but his well visit was a G0402, that Welcome to Medicare, that IPPE visit. So I know that his next visit, even though it's been over 2 years, I want to make sure I'm billing as a Welcome to Medicare, or sorry, an initial annual wellness visit. And Alex and Neil, I want to make sure that I'm billing for as a G0439, that subsequent annual wellness visit. So this is a tool that you can use to identify patients to start proactively scheduling, and you can use this as a tool for making sure that our billing is what we expected it to be. Sometimes if you're a practice administrator, you may want to go in and take a look at what was the historical codes billed for your practice to ensure that not only are you billing for the Welcome to Medicare visit, but you don't have a biller that's accidentally billing for a number of initial annual wellness visits as a 439 and missing that revenue opportunity for yourself. So the annual wellness visit report, that can be used to act on immediately. That's, I would say, essentially really usable, really actionable information. The transitional care management report is going to be useful, but not necessarily as immediately actionable. I'd say this is a really good tool for tracking our progress on doing well visits, but because the information populating in here is based on claims, it's going to be typically 30 to 45 days old. So it's not going to be current enough for you to do that transitional care management visit on, because you would have had to make the phone call to the patient within the first 2 business days. We can use this report though to track, are there missed opportunities, or are we having a number of patients that are being billed for as a 99214 that we did actually all the steps. We did the interactive contact within 2 business days. We did the visit within 7 days, but we didn't bill it as a 99496. So that would be an opportunity for using this report to go back and maybe find any missed billing opportunities or find any trends that just don't quite seem right to us. Now, as we're looking at this information now, or if you go out and play around with it today, I would encourage you to maybe drop your discharge date back to 1/1/17. It's going to probably pre-populate as 1/1/18 because we're only looking at about a month and a half's worth of data for 2018. It might mean a little bit more to you to go back and look at 17 and the first part of 18. So similar to before, where we can drill in to see kind of that next step, if we click on Thomas Lee's name, we're then able to see which patients were associated with Dr. Lee and whether or not they were discharged to a home, discharged to cell. And then if we clicked again one more time on each of the patients, we could see the specific discharge and the specific DRG for that patient, maybe where they were discharged to or where they were discharged from. So I think that's an opportunity to start to work back and identify those missed opportunities. Where did we maybe not capture information that we think we should have? So for this patient, I would probably look at Alex's lifespan and trying to identify, where were they discharged from, because it seems odd that we did not do either a TCM or a PCP visit on them. The other primary care visit that would be showing up, that's just a E&M code that's not a 99496 done by one of the ACO providers within our group. Similar to before, we can take this information and export it out using either the print function or the disk function, and the disk function has a drop down that lets you click Excel. Excel is usually my preferred way of looking at most of this information, but it's a way to track and monitor our progress on some of these things over time. An extra or additional report that you may use is a home health cost by practice. This is a report that's going to show any patient attributed to the ACO or attributed to your practice that has received home health services over the course of the year. Now, this is a report that's going to show essentially every patient that has received, and not necessarily the patients that we know are actively receiving home health. So I would encourage you to use this report and kind of develop your own internal workflows. What I typically see is take the report and then month over month do kind of a true up of what patients were added, which patients were removed, as you're also tracking this on your own to see which of my patients are actively receiving home health services. And this is a great way to ensure that a patient that maybe doesn't qualify for the service doesn't stay on longer than they needed to. The home health claims, as they're paid, and home health claims are kind of funky, but they are usually paid as a day one payment, and that day one payment will show as a only a 1 day payment. So it'll be January 15th, 2018, January 15th, 2018, and then 2 months later you're going to see a claim for March 14th, 2018 that's going to show the 60-day payment, and there'll be almost like a negative for the first one or a 0 for the first one and a full amount for the second one. I just want to caution the group of, if you're looking at your home health claims and you're figuring out why are there a bunch of 1 day stays, that doesn't quite make sense, especially as we look at our initial information for the year, where there's going to be a lot of patients that maybe have started their certification but they haven't closed it yet. There might be a number of 1 day certification periods in there. Another thing that I like to caution when we're looking at home health information is that, to me, or from my experience, paying attention to the number of patients on home health services or the number of recertifications for each patient is often more valuable to me than, or maybe more meaningful to me than the number of certifications per patient, or visits per certification, or visits per patient. So number of certs, number of patients, from my experience, is a little bit more meaningful or a little bit more actionable than the number of visits per certification. The inpatient admissions by practice report will allow us to trend which of our providers are maybe a little bit more likely to have one of their patients go to the hospital, and then we can click in through this report to be able to not only identify which patients are going, but what was the claims associated with each of those patients. It's going to have very similar information to that TCM visit where you're able to drill down into it, but it allows you to compare inpatient utilization rates for each of your providers. And I think that's helpful for starting to identify outlier trends, or providers that are maybe a little bit more likely to have one of their patients go to the hospital than others. This information is not risk adjusted. It is just straight, these are your patients and patients associated with your practice, and these are your patients that were seen in the hospital. Your at-risk patient report is an opportunity to, from a high level, take a snapshot of how many patients do I have that are these Medicare shared savings attributed patients that have diabetes, have heart failure, have hypertension. This can have an impact on how you want to approach maybe your coding. This can also have an impact on how you want to think about some of your different quality measures. If I know that I have a practice that has say 50% diabetics, 40% diabetics, even 30% diabetics, the way I'm going to think about that diabetic eye exam might be different than this practice that has 14.8% diabetics. If I had a higher proportion of diabetics, I might be more likely to think about maybe purchasing a retina view. thinking about opportunities for ensuring that I'm getting those quarterly A1Cs done on a greater proportion of my patients, as opposed to a one patient at a time thinking about diabetes. So it might be a disease-specific protocol or disease-specific action step that you might want to take. It could also be helpful to think about maybe undercoding or underrepresenting how sick or how medically challenging some of my patients are. If we're not coding for heart failure, if we're not coding for diabetes because we don't want to place that down on the patient's page, and instead we're diagnosing them as pre-diabetic, that is information that's maybe not best reflecting how sick our patients actually are to Medicare, and that can make it more challenging for the ACO because it can have a negative impact on our benchmark. So we want on our kind of that cost target for ourselves. We want to make sure that CMS knows how sick our patients are so that they can give us credit for it. And part of that is we want to make sure that we're documenting on all these conditions associated with our patients. Now, one of my favorite reports in the tool is the high-risk patient report. Now, this is a way to, if you were looking at maybe developing a specific disease protocol platform, or if you were looking at developing a chronic care management tool or program for yourself, you can use this high-risk patient report to identify which of my patients, and use the drop down here to say maybe had 3 or more admissions, but you're not as concerned about ER visits, so you're going to say any. But you're not as necessarily concerned about costs, so you're going to say any. But you're going to probably adjust your time. What was that, Lori? And then you can identify which of your patient groupings are you most concerned with. Then these different conditions that are down on the bottom, they say no or yes, but it's a little confusing because if it's a yes, it has to be true. If it's a no, it can be true. So if I click yes to diabetes, that means that the patients that are going to populate on that list next have to have diabetes. If I click no, but I maybe click yes to coronary artery disease, I may or may not have diabetic patients that would show up, but I would for sure have patients that have coronary artery disease. One of the next things that I would typically look at, like to review with you guys, is how do I add users? Now, different team members within your practice are going to use the tool a little bit differently, but it's always important to make sure that those that need it get kind of the information that is available to them as soon as possible. So if you as a administrator of the ACO Health Solutions portal for your practice wanted to add another user, you would go to this practice users link on the bottom, and then you would click the person with the plus, and clicking the person in the plus will allow you to, just by an email, add another user to your practice. And clicking that will, this is the equivalent to what Lori would have done for all of you last week, that pushed that initial support email to you to set up your account. Now, if there's an extended period of time of inactivity, ACO Health Solutions actually will disable anyone's account. And this has happened to me from time to time as well, or they may cause forced password resets as well. If that happens, we can, either Lori or myself can re-enable your account, or resend out an updated password for you, or allow you to access your information once more. So if you have any trouble with your password, if you're the practice person that has the admin access, so meaning you would have had this little checkbox here, you can reset anyone else's password. And if you need any help, contact Lori or myself and we will reset your password. And from time to time there will be a need to reset your password, so just try and keep track of those however you can. Or I know it can be challenging for me to make sure that I'm always remembering my passwords, but however you can to always remember your passwords is going to be important. Okay. With that, I'll leave it open to any questions or comments from the group, and then Lori and my contact info is on here as well if you would like to reach out to us directly. We will be sending these slides out Thursday afternoon, and hopefully the audio quality is okay, but I am trying to record today's session and I plan to upload it to YouTube like the other session that I did.